Okay, this is the third session in the prostate cancer pathology station, and in the last session we stopped in the gene mutations involved in the pathogenesis of prostate cancer. They are going to ask you, do you know the gene mutations involved in pathogenesis in prostate cancer? Okay, and here you are going to tell the following answer. Okay, this is one of the questions that you will not forget it, you will not remember its answer inside with tension. Most of the people lose the marks of this question, so I want you to focus here because it is easy. Okay, there are 4 gene mutations or genes that are involved in this. You want to know first, and in this way you will have half of the marks of the question or of the answer. Number 1, BRCA1 and 2. Number 2, HOXB13. Number 3, MLH1. Number 4, MSH2. Okay, so these are the 4 gene mutations or genes that may have a relationship with the pathogenesis of prostate cancer. Okay, there is another thing, and that thing is acquired. There is another genetic lesion, and that genetic lesion is an acquired lesion. Okay, it is an acquired lesion. Okay, acquired genetic lesion, and here I want you to focus because this will take half of the marks of this question. Okay, so the most common acquired genetic lesion in prostate cancer is something called TMPRSS2-EDS fusion. Okay, fine. So I wrote it all for you. So this fusion gene mutation and deletion here, it is TMPRSS2-ETS. Okay, the mutation and deletion in this gene will lead to something else that I will mention now. But if you want to remember this, it is TMPRS2H. We call it Trump etc. if you want, Trump etc. But you can find your way to remember this. Okay, so this thing, okay, this fusion gene mutation and deletion, okay, is going to lead to the activation, and this is the main point here. It's going to the activation of a pathway. This pathway is called a signaling pathway. Signaling pathway. Okay, and this signaling pathway is called as follows. You need to keep this in your mind. I don't know how. PI3KAKT. Again, the most common acquired genetic lesion in prostate cancer occurs in the we call it Trump etc. or TMPRSS2-ETS fusion gene. The mutations of them or deletions will activate the pathway of PI3KAKT signaling pathway. If you could be able to save this in your mind and say it in the exam, I guarantee you that you will pass this exam. Believe me. Okay, so I will see you in the next station.